I'll be performing the donning and doffing of the sterile gloves. Now I'll be gathering the equipment such as the packaging of the proper sterile gloves. Now, prior to performing the procedure, I'll be introducing myself, the patient. So, assuming that there's a patient, I'll be introducing myself. My name is Myron Alak, student nurse from the University of St. Louis, Tuguegarao. So, now we'll be identifying you. What is your name, birthday, and your age? Okay. Now, as explaining to the client that it is necessary to wear gloves to avoid contact contamination, to avoid spread of germs or diseases. Now I'll be performing the hand hygiene. As performing it in the other video, the hand washing, now I'll be providing for the client's privacy. As we are assuming that there is a curtain, I'll be closing the curtain. So now we'll be assessing the package, the gloves. It is intact, it is not wet or otherwise contaminated, it is not out of date. Yes, it is not out of date. Now I'll be assessing the local environment. Then there's a suitable opening for the package and applying the gloves. Is it dry? Yes, it is dry. It is not wet. Is it reasonably stable? Yes, it is reasonably stable and horizontal. Are there any obvious airborne contamination? Obviously, there are none. Now I'll be reading the manufacturers or the instructions. Package sterile gloves. Now I'll be removing the wrapper from the package and placing it on the inner wrapper later at the table. As you can see, it is my hand size for wearing the glove. Now I'll be identifying the right and left. This is the right, as you can see in the packaging. This is the right, the R, and this is the L, which is the left. Now I'll be grouping the two. Now I'll be opening the package. Okay, now I'll be grasping the 2 inches or 5 centimeters wide of the thumb and first 2 fingers of the dominant hand. So first I'll be identifying the left and right, which is the dominant hand. This is the dominant hand, my right. Now I'll be grasping it 2 inches, 5 centimeters, and I'll be putting it by holding the cuff. It is still necessary that if you cannot put it in later on, I'll be explaining that. I'll be slipping it on the fingers, then I'll be using it. The gloves onto our non-dominant hand by using this method, by putting our sterile part on the sterile glove to the sterile part of the left glove, then making sure the fingers slip into the proper spaces, adjust the gloves if necessary. So now we can adjust it because we are now in the sterile part of the glove. This with both hands. Now with glove hand, we'll be interlocking the fingers to fit the gloves onto each finger. Now we keep it 6 inches away from our clothing. Then we keep our hands above the waist level and below the shoulders. Now, if the gloves are soiled or removed by turning inside out as follow, remove first the glove by grasping on its palmar surfaces. So now, we'll be using that first. It will be our dominant hand. Then we pull the first glove completely off by inverting it, rolling the gloves inside and out as you can see. And now we continue to hold the inverted removed glove by the other fingers of the remaining glove hand. Now place 2 fingers of the bare hand inside of the cuff. Second glove, pull the second glove inside out as well. Then this pulls the first glove inside out the second glove. Now, we dispose the solid gloves into our packaging. Now, we'll be doing a proper hand hygiene by alcohol. So, thank you for watching the video.